Record. Right. So, welcome everybody to the Shoreham Network. And tonight, Shoreham Network is centered around the Harbour View. Oh, I've started again, isn't it? The Adur Health Partnership. And to talk about it and life as a doctor or a GP in the last 14 months is Dr. Mark Halloran. So, welcome.
Hello, nice to see you. Hello, everyone. First of all, I apologise. I'm doing this from home, so if there are any children barging in or whatever else, then such is life. I'm afraid that's how things are nowadays. I'll try and keep my presentation fairly brief and allow time for questions. I'm sure there's all sorts of things that we could talk about. I've chosen just to I'll just introduce myself and I'll introduce the doctor's surgeries and talk a little bit about that. And then I've just chosen to talk you through the last year since kind of February, March 2020. So if you're interested then, and I assume you are because that's why you're here, I guess, then you'll get some insight into what life has been like over the last year or so. For me, I'll try and tell you a little bit about how it's affected some of the staff as well, but it's going to inevitably be a bit of a personal view on things. I'll just get going in that case. I'm going to drop out, so you're going to miss my face, which I'm sure you'll survive somehow, and instead I'll just have the presentation, and then when we come back to the questions, I'll put us all back up again. Now let's just see if we can get this working. There we go. Can you see the presentation?
We can indeed.
Fantastic. Right. So we'll go straight on into who am I. So I'm Mark Halloran, Dr. Halloran, one of the GPs in this thing which we're currently calling Adur Health Partnership, which is the partnership of the three big practices in Shoreham. So that's Manor Practice, Northbourne and Harbour View, which are all working together now. I've been a GP partner at Harbour View, so that's the Shoreham Health Centre now, for around about 12 years. And I'm currently mainly based at Northbourne. And that's happened this year since the vaccinations have happened. I've taken the lead on the vaccinations, and last year for the health centre and also for Downsway, which is the other the branch surgery I didn't mention, which is up in North Southwick. I've been the COVID lead, and I've also this thing, I've put a couple of other things. I'm a trainer, so I train other GPs, and I'm also something called a PCN CD, which stands for Primary Care Network Clinical Director. So that's it's maybe taking a slightly bigger view of the work we do, not just as a general practice, but also thinking about linking in with some of the other services out there, such as the district nurses, who in the old days used to be part of a GP practice, but ever since I qualified and for quite a while before, they've been quite separate. So there's quite a lot of other NHS organisations. The NHS is never quite as simple as you would want it to be, I don't think. So that's me, and that's me having, I think, the second vaccination in the area. So it'd be right at the beginning of January, and being given that by Dr. Howard, Simon Howard, whose birthday it was that day, who had the first vaccination. That was his birthday treat to get his first vaccine. Just for those of you that don't know, I thought I'd show you some pictures of the different sites. So this is a picture of Northbourne surgery, which is on the Upper Shoreham Road next to Southlands Hospital. We've got the Manor Practice, which is next to Southwick Library. So that building, as you see it, the slightly higher part is the GP surgery, and the slightly lower part on the other wing, as it were, is Southwick Library, and that's quite close to Southwick town centre. Shoreham Health Centre, and this is a slightly nostalgic picture of Shoreham Health Centre from when it used to have Burscroft attached to it, which is now gone, and instead there's a large empty space. And I haven't explicitly put anything in here about the redevelopment of Shoreham Health Centre, but I'm happy to talk about that if there are any questions about where that's heading, if it's heading anywhere. But I'm happy because I've been involved in that a little bit as well, quite a lot as well. And then last but not least, this is the Downsway site, which is, as I say, just in North Southwick. So if you know where Tops Tiles is as you come along the Upper Shoreham Road, actually heading away from Shoreham, you would turn left just after that at the traffic lights, and one of those roads is Downsway, and this is a converted bungalow, which doesn't look very big. There are 3 consulting rooms, 3 decent sized consulting rooms, and a couple of smaller ones there. It's actually quite a nice little site. So if it's okay now, what I'm going to do is I'm going to talk you through my year. So we'll start off right at the beginning. So back in February and March last year. So really, I've tried to put it into phases, which I think there probably were, and I've tried to highlight some of the issues. If I was to go through everything that was involved, we'd be here until Sunday morning, I think. So I'll try and kind of give some kind of broad themes to it. I think, like everyone else, we went through the biggest change during that time period that they've ever been through in their lives. And for general practice, it was interesting seeing how we all personally responded. It was interesting looking at the organisation, and also how the wider NHS responded. Some of the things that we have done over the last year and that were introduced very quickly in particularly in March and early April were very much led and mandated actually by the central NHS leadership, and in some ways that's a good thing. The NHS has a very centralised management structure currently, so there were lots of things that were put into place very quickly, but some of the things that I think have frustrated patients at times have also been things that we don't necessarily have local control over. But at that point in time, it was a time when I was every evening, morning, looking at updates that were coming through about what we should and shouldn't be doing, how we should be changing things. And that carried on for a few months, really, where it was, I'm sure everyone else was watching the news all the time. I actually didn't have a chance to watch the news very much because I was so overwhelmed by the amount of updates and advice on the science behind COVID, but also the organisational steps that we had to put in to protect our patients at that point in time. And really every single process that we had to evaluate how we would do it, or if we were going to do it through the lockdown. So obviously the change between February, when we were still seeing patients entirely normally, through to May, when we were trying to do as much as possible by phone and by video and by text, was absolutely huge. And some things we knew we shouldn't be bringing patients in. So some things, it was obvious that the risks to patients of coming into the surgery were completely outweighing the benefits. And there were other things where it was a more nuanced decision as to what the right thing to do was in terms of patient safety. And then there was also quite a lot of the emotional balancing as well, because there were things that objectively, in terms of someone's health, may not seem that important from a doctor's perspective, but some patients hold them very dear. And so there were some difficult decisions to be made. As I say, some of it was nationally mandated, and some of it we had to apply our own nuance to it. Second thing I popped on the list was the IT issues. The picture there hopefully demonstrates a little bit about our quality of technology at the beginning. So that was an attempt to have a video chat. We only managed to get one person on each screen using I think maybe one of them was using MS Teams, one of them was using Zoom, and one of them using FaceTime. And we just put them all next to each other, and they could still hear each other, but it's not the best way of running a meeting. But we've got that sorted now. So I think everyone's now completely kind of on top of the technology, but it certainly took a while. The NHS wasn't ready, I don't think, certainly not from a technological point of view. But I think there was a lot of ingenuity that went on, a lot of learning. And by May, I think we'd got a lot of solutions in place. What we saw very quickly following the lockdown was a reduced patient inquiries. So there was a time in general practice where, even though I was spending an awful lot of time reading the latest guidance and implementing it, the actual number of patient inquiries dropped very soon after lockdown. I think patients heard the message that the government put out about protecting the NHS, and sometimes that message may not have been the right thing. And I think we recognised it at the time that there was more of a drop-off in patient inquiries than we would have expected. We knew that patients didn't want to go into hospital at that point in time unless they absolutely had to in the first months of the pandemics. And it's been borne out that patients had the right perspective in many ways, because we've seen in the news in the last week that there were lots of infections that occurred in hospitalised patients throughout the course of the last year. So I think it was a difficult decision for patients, and I think lots of patients made a decision to hold on to health problems for longer than they would have done normally themselves before approaching us as GPs, for fear of the fact that we might tell them they needed to go into hospital. And that was a double-edged sword from our point of view. At that time, in between February and May, we had a drop-off in workload at a point in time when we were really busy with the adaptations we were making in practice. But the other perspective of that is those problems that people held on to did come up later. So I'll tell you about some of the other times when things have maybe returned a few months later and with worse problems. And unfortunately, every lockdown has been similar. So we found again, the first few months of this year, they were slightly quieter, and unfortunately now there's a huge amount of workload that we're currently going through at the moment to pick up. Really, if I'm honest, for lots of things that have happened over the whole of the last year or so. Our staffing rates right at the beginning were terrible, because we were being as careful as we possibly could be not to let anyone in with any COVID type symptoms. And that first lockdown was in March and April. There were many people with coughs and colds and just minor illnesses. We didn't actually have anyone who had a confirmed case of COVID at that point in time. But as a result of keeping people at home and not having the IT available at that point in time, we were very low in staffing numbers. And there was a huge amount of anxiety amongst many of our staff about the risks that they were placing themselves in during that first lockdown, when we were all, I think there was a degree of anxiety about what COVID was and how it could be transmitted. And I think particularly for our receptionist, it was a shock, I think, to quite a lot of them, even though we know that we're talking to ill people every day and we're talking to infectious people every day. When you're faced with a global pandemic, I think it hit some of our receptionists in particular, and some of the doctors and nurses, to be fair, quite hard, that they were putting themselves at risk. So we had to work quite hard to make them feel safe at work. And we did, again, we reorganised quite a lot of stuff so that some of the more vulnerable staff members were kept away from patients entirely during that time. So we had to take quite a lot of people and we moved them to a building, to the Downsway building, and didn't have any patients into that building for around about 4 or 5 months. And they were only doing telephone work, which helped to a certain extent with that anxiety. Thinking about the kind of the next steps, I've got a picture of me on my birthday, which is the 5th of June. We were starting to start things back up again. We knew that there was a lot of work that we would need to catch up on. And we were starting to see a few COVID cases, and we set up what we call a hot hub, which was a daily clinic every day, separate from all of our other services, with a separate entrance, with separate doctors and receptionists that didn't engage with any other staff or patients during the day, so we could get a very clear line between the COVID patients that we were seeing and the rest of our work. Again, partly about protecting our staff, but an awful lot about protecting the asymptomatic patients, so patients who didn't have any symptoms of COVID. Of course, we couldn't be sure at that point in time because we didn't have the lateral flow tests or the PCR tests availability that we have now. But I think we set up a very effective system. I'm proud of what we did. To my knowledge, there's been no evidence of any transmission within any of our sites. So we've had plenty of patients who've been diagnosed with COVID, and we have had staff members who have had COVID. But to my knowledge, none of those have happened at work. So when people have caught it, it has been in relation to their lives outside of work. We did some weekend work, which we hadn't previously done. So I was working kind of fairly full week, and then at the weekend I'd be providing care for our care homes on the phone, again not in person during the weekends, but on call from 8 in the morning till 10 at night, Saturday and a Sunday, and then going into the following week. Again, it was quite hard work. And then I put there was that time, and you'll probably remember this phrase of the new normal. So we were having quite a lot of discussions about how can we do everything? How can we get the patient seen whilst maintaining social distancing, whilst cleaning everything? We're still struggling to a certain extent with how do we manage the volume of work that is there whilst keeping everyone safe. And there is a tension, particularly around premises, actually. And at the moment, there's the vaccination program as well on top of that, which I'll come to. So, as you might have noticed from the way I was talking earlier, in September and through to December, we started seeing lots of problems that hadn't been raised during the earlier parts of the year. So we were trying to do as much as we possibly could in terms of all of our services, dealing with all the health problems that we could during that time. But I remember particularly a time in kind of October, November, when the kind of the stress on the staff at that point in time was huge. And we could see, as I put that picture there, we could see the cases were rising. And we didn't know what to do about it, to be honest. We knew that we were doing everything that we could. And at that point in time, I think, and throughout this pandemic, it's been obvious that the only thing that's controlled the cases, other than the vaccinations to a certain extent, has been lockdown. And then I think we were struggling, particularly in the run up to Christmas, seeing the massive rise in cases that occurred in Shoreham and Southwick throughout the latter part of December, and then it continued into January, which stemmed, I think, an awful lot around secondary schools, and then secondary school children bringing the cases out into their families and the wider community over Christmas. And what started off as being young people with the Kent variant, we have to assume, turned into quite a lot of older people. Yeah, I think we were very grateful that the lockdown was imposed as it was at that point in time, because that kind of coming into January was very hard. I've also popped down the merger there in terms of the 3 practices. And again, if anyone's got any questions, I'm happy to talk about that. But as I said at the beginning, the 3 practices, Northbourne Manor and Harborview at Shoreham Health Centre, are all working together closely. And that really kind of kicked in around that time as well. So in terms of some of the legal work that we had to do to kind of form as one business, which was an added pressure that we didn't want, but it had been planned for quite a while. So there wasn't going to be a better time in terms of doing that. So that was one more thing on top of everything else. Now, the next stage, we're almost finished, and then I'll have a rest from my own voice for a little bit. January into March. So it felt at the beginning of January, with the vaccines coming through, like it really was a race against time for getting these vaccines out there. In the other slides, I've chosen individual pictures to put alongside it. And this one, I looked at January and I realized that I really, on my phone, I hadn't taken a picture of anything else. So there's pictures of boxes full of vials there. There's pictures of people in the clinics. There's pictures of people taking the vaccine out to care homes. There's pictures of the car park, because a large part of this has been the logistics about how do we get enough people through the centre in a way that's, this is mainly at Northbourne, we've been doing the vaccine work. How do we get people through safely with social distancing in place? Because we were terrified, I think, in January that we were trying to do good by delivering the vaccine programme, but the last thing we wanted was for anyone to catch COVID when they came for their vaccination. That would have been a disaster. And we were looking at a time when 1 in 50 people had COVID at that stage in January. So if we were taking through several hundred people in a morning, we were probably going to be seeing at least 1 or 2 people, maybe more, with COVID at that time that would subsequently be diagnosed. They wouldn't have had any symptoms, but they were still going to be a potential risk. So we were being as careful as we could about social distancing and all the rest of it, bearing in mind, obviously, as staff, there's no way you can deliver a vaccine from 2 meters away. We're not allowed to do it like darts, unfortunately. We do have to aim and make sure we hit. So it really felt very pressurized, and it was very, very rewarding work. And I have to say, particularly, I think, thinking about the care homes at that point in time, the evidence was that for every 20 vaccines we delivered in care homes and nursing homes, we'd save a life. And we've got 10 care homes with around about 300 patients in them. So we knew that we were saving lives very quickly by getting those people vaccinated. And I have to say, sadly, we weren't in time for one care home where really the week before we got the vaccines, there was a huge outbreak and quite a lot of their residents did die. And there were 2 other care homes that were on the verge of that had a couple of cases shortly after we vaccinated. And I have to say, I think the vaccines did prevent any large-scale outbreaks in those care homes. And so I think that figure that's quoted of 1 in 20 people, it felt accurate at that point in time. And certainly as a doctor, it's one of the most powerful things I've done, to be able to protect so many people in such a short period of time. And obviously it was also the case for the wider population. But whereas we were vaccinating a lot of the elderly patients who'd been quite good at shielding, it's very tricky for the care homes to manage that with multiple staff coming in and out, and the fact that COVID wasn't necessarily always visible. So I think you can make sure your staff don't come in if they've got a cough or a cold, or fever or whatever else, but some of the cases there were no symptoms, and I think that's been very hard, and I feel very sorry for lots of the care homes that have struggled with this. So it really did that kind of time during January. I've never worked harder than I did then, and 12-hour shifts repeatedly vaccinating. But it was the most rewarding month or so of my life, probably month and a half or 2 months, I think, that time. Things have settled down. So as we got used to the vaccines and understood it more, we've managed to the kind of logistics of the vaccine clinics has been better organised. But as we've gone on, so as lockdown has been reduced and everything's been opening up, we've again hit that problem that we had, I talked about at the end of the kind of autumn time of last year, which is there are a lot of problems that have been saved up during the early months of this year that we're trying to manage at the moment, and it's really tricky managing it alongside the vaccination program. So I put down 23,000. We've actually at Northbourne managed to deliver about 26,000 vaccines so far, and quite a lot of our patients will also have had vaccines at other areas as well. But the majority of vaccines have been delivered at Northbourne by our GPs and our nurses, working extra hours on top of what they normally do. And I think it has led to a degree of burnout. And I don't know if that's a phrase that people are familiar with, but most people in the NHS will be familiar with it. It's the idea of how you can cope as an individual when you're under significant stress and pressure. And we've all had times when, well, I think all of my staff had times when they've struggled to be able to be there emotionally for their patients, and to be able to function as they'd like to at work because of the stress. And it has, I would say, been the opposite of when the public have been vocal in their support. So it's a very strange experience last summer, thinking back to the times when the NHS was being clapped in the streets. That was actually a time of relatively little demand. Patients, as I say, were holding things themselves. And then when everyone stopped clapping was the time when everyone came back and said, well, you haven't looked after me for the last 4 months, I want to be looked after now. And then that kind of delayed wave of inquiries, which I think we're experiencing again at the moment, has made it hard. And it's certainly we've struggled to meet the expectations that we hold for ourselves, let alone what our patients hold for us. So it's been an interesting time, and particularly at the moment trying to manage the vaccination program. I think a lot of our staff are struggling, and it's trying to find a balance to look after the patients who are struggling whilst making sure that our staff are able to do the job because they're well enough as well. And it's tricky, and I don't think there's necessarily an answer for it. But if I'm going to be honest about what's happened to us as an organisation, I think we've done amazing things over this year, but I think it probably has taken its toll on quite a lot of us. And I'm not entirely sure when we're going to get a chance to recover from that, if I'm honest. I think that's the kind of the slightly sad thing at the moment is there's no kind of summer holidays in sight for us at the moment. It feels like at the moment the pressure is going to continue quite a while. I'd like to end on a really positive note. I guess this is probably the main thing. I've just given you a picture of what so these graphs, I'm sure some of you will have been looking at these on the BBC or whatever. The first one shows what we were like in December, where we could just see that peak. starting to rise. And the second one, the scale on the side is quite different. It shows you quite how high that peak, and this is a local view of cases, did rise during that January. But it also shows how well we've done locally in keeping that line flat, and that's going up to the 17th of May. So it's about a week to 10 days out of date at the moment. But certainly I would say that throughout all of this, Ada have, as an area, have done very well in terms of managing social distancing, lockdown, dealing with everything very, very sensibly as a group of patients, as a community. Other than, I think, when the Kent variant came along in December, and as I say, spread through the secondary school and out into the community, and that's that huge spike that you see there in the middle of that graph. And I think when I read the news about the Indian variants in places like Bolton, I feel for the staff there, because I know what it was like to go through that last wave here, and I hope that they're not going through those same things. I would say I think the reason that it won't be like that again is the vaccination programme. And I think in Bolton, whilst they've seen a rise of cases, which is similar to what you see on this graph, I think the number of hospital admissions, the number of patients in ITU and the patients dying, I don't think they're seeing that spike. I think that is all down to the vaccination programme. So I feel very strongly that the huge success that we've had, I think nationally, but also locally with the vaccination programme, is a really powerful thing. And if I had to give one message out to all of you now, it would be to encourage everyone you know who hasn't been vaccinated to come forward and have a vaccine, because I think that is the thing that means we're not going to be repeatedly experiencing the kind of pressures societally, but also from our point of view organisationally, if we can get good uptake. And I have to say, we have had good uptake locally. We're better than many, many other areas, but there are still people that haven't had it in all age groups. And what we're seeing in places like Bolton is that those people are struggling with it, with the new variant there. And I imagine that cases will rise. This flat line that you see on the graph, though, is not going to stay flat forever. And if we can get as many of our population protected as possible, it's worth it for all of us. So I'm sure you've all had your vaccines. If you haven't, that'll be the first topic of conversation I'd like to have with anyone. If there's any skepticism about the vaccines, I'm happy to go through with that, but happy to take questions on absolutely anything you want to. Let me just see if I can bring us back to the main screen, so hopefully we'll be able to see each other again, which would be nice. Hurrah. Is that working?
There you are. Thank you, Mark.
Yay.
That was
lovely.
Good.
Nice to see your face.
Encapsulated the last 14 months perfectly. Thank you so much, and to you and your colleagues for all the work that
That's okay.
It's so appreciated. Hi everybody. There's quite a few of us on this call, about 20. Is there anybody who'd like to ask any questions? I have 3, but I'll let other people in first. So if you're in the chat, or would you like to wave at me? I'm going to change the view so that I can see anybody wave. Oh, look, there you are. Anne, welcome, Anne. Can you take yourself off mute and then have a chat? You're on mute, man.
I've taken it off. Hi, Mark. I've put it in the chat anyway, but slightly related perhaps to the merger, I don't know. Shoreham has significant numbers of new homes. Are you confident that primary care capacity has risen or will be rising to match that?
It's very tricky. I would say that I don't know that primary care capacity even comes close to matching the potential demand we have at the moment. So it's very difficult for me to say, I think that we can match future demand. We're looking at all sorts of ways to improve what we do. There are a limited number of GPs out there, so it's not always possible to recruit new GPs. So we've brought in lots of other professionals over the last few years, and this is happening nationally as well. So we now have several paramedics working across the sites. We have pharmacists. We have these people called social prescribers that are looking at people's health from a kind of wider angle. We're training our receptionists up into roles we call care coordinators, so they can help navigate people around some of the complex areas of the NHS and their health. So we're doing an awful lot, but that may not be enough to always match demand. We're also exploring, and have been exploring for a long time, new premises at Shoreham Health Centre, which we feel is necessary. But that again is a funding issue predominantly. And we don't have the funding, we don't have control of the funding. So it's very much about looking for help from the NHS, but also I think the councils as well. So because that site is a kind of combined site with West Sussex County Council owning the library, Ada District Council owning the green area out the front, we've worked as hard as we can with them, but I don't think they've got much money either. So there are definitely a lot of reasons why we may struggle to match the demand, and probably we are struggling to match the demand. But there are ways of doing things that will help us. So the other thing that we've done a huge amount over this year, and we will continue to do, is well, if we haven't got the space to provide the service during the week, we'll work our weekends to try and make sure that we can provide more care then. So, you know, that's logic, isn't it? That if you've not got enough space, you just have to find ways of doing it. We're working more mornings and into the evenings. So I think quite a lot of people will probably end up having had telephone calls with their GP later on in the evening than they would have done otherwise. And I'm not sure it's necessarily sustainable for our staff, but we'll work on it. So that's a qualified yes. I think housing is really important, and I do think that that we need to build houses particularly for some of the younger families that can't get on the property market. And I wouldn't want to have like a clear picture that I don't think it's a good idea. I think it is a good idea to build new housing. But if there was one thing I could ask, it probably would be for the councils to help us with the infrastructure to support that. In particular, in terms of staff, there's not much that our local councils have control over. But that's probably a national issue.
Does that answer your question, Anne?
Thank you. That's very comprehensive, I have to say.
I can't help it, I'm afraid. If you ask me a question, I'd love to be able to give you a two-sentence answer, but you're going to get somewhere between an essay and a rant. I'm not quite sure what you'll get. No,
it's cool. I mean, traditionally, most of the power in the NHS sits in the centre, doesn't it? And kind of there's not a huge amount but locally to change the global sum or anything. So yeah, I mean, just if us locals could support in any way, you just have to shout, really. I
think it's really tricky. I was thinking that because I assume that someone might kind of mention that this evening, and there isn't an easy thing to do, because what I worry is if I tell you that we're struggling, then some people hear that and they will then respond by saying, oh, I don't want to bother the GP, which is not necessarily the right way of responding to that, because I want to see people who are ill. That's why I'm here. And if you're ill, the last thing I want you to do is to brush important symptoms under the carpet and leave it. It's not good for you, but it's not good for us either when we eventually do have to see you. We'd rather catch things early and get things treated appropriately. So it's a tricky mess.